it's really a breach of trust. And, as a Canadian Health Coalition, we feel totally betrayed.
Health coalitions across Canada are calling for the resignation of the CEO of Canadian Blood Services after they signed an agreement with a private company to boost plasma supply.
Experts are absolutely against this. The World Health Organization, the European Blood Agency, any number of organizations have come out and said that there are real ethical concerns when it comes to putting our blood supply in the hands of private suppliers.
Canadian Blood Services has signed a 15-year agreement with Spanish company Grifols, who pays for plasma and turns it into immunoglobulins, which are the most widely used plasma-based medications, according to the CBS. The Canadian Health Coalition says this isn't ethical.
We're not in favor of anybody being paid to sell their blood or their plasma products. No, we're not in favor of that at all. And all they have to do is set up clinics that make it more accessible for people to do it and put out, calls, because there is a need. There's a constant need.
When the deal was done, CBS CEO Dr. Graham Scher said this agreement puts controls in place to ensure the plasma collected in Canada stays in Canada and can't be sold offshore, calling this a transaction that serves the domestic market that already purchases most of their plasma products from U.S. manufacturers, since they only meet 15% of plasma needs through local donation.
This is really about continuing to build our own plasma collection network, as we have been doing, but accelerating the opportunity to get to that sufficiency target so that we can minimize any risk to patients of security of supply down the road.
This is a matter of life and death for a lot of our patients.
Jennifer Van Gennep at the Network of Rare Blood Disorder Organizations says they've been asking for a deal like this for years. She says her organization shares the concerns others have about the privatization of healthcare, such as clinics, but says what the CBS did was very different.
We absolutely believe that whole blood, should be donated freely and given freely in the hospital when people need it, that system should stay exactly as it is and stay completely voluntary. We're talking about plasma collection, which is already a privatized. It's already a privatized market. Plasma and plasma products, that's already monetized. We're already buying those products. So this is just about, there's no safety concerns at all. It's really just about supply and securing the supply for Canadian patients.
In a press release, Grifols says a newly built state-of-the-art Montreal plant is expected to start operations in 2024 and be fully operational sometime in 2026, when the company will become the only large-scale commercial manufacturer of plasma products in Canada. Until then, production will take place at its site in Clayton, North Carolina. In Winnipeg, Mike Albanese, City News.